Good day, everyone. I am Marc Loyd Maderal from Section 105, Speech Communication, JEDO 109, held by Mr. Edmund Ajimba. Today, I will be deliberating my presentation entitled General Information Regarding COVID-19 that will tackle the history of COVID-19 symptoms, COVID-19 health guidelines, COVID-19 transmission, COVID-19 statistics, and COVID-19 treatment. And let's move forward to our objectives. And here are the objectives of this presentation. Understand what is COVID-19, raise awareness about COVID-19, and help to prevent COVID-19. After knowing our objectives, let's move forward and let's start with the history of COVID-19. According to WebMD.com, expert claims that SARS-CoV-2 emerged in bats. That's also how the Middle East respiratory syndromes and extreme acute respiratory syndromes coronaviruses began. At one of Wuhan's open-air wet markets, SARS-CoV-2 made the transition to humans. It's where consumers buy fresh meat and fish, and even animals that are slaughtered on the spot. Any markets including cobras, wild boars, and raccoon dogs sell wild or banned animals. Crowded environment can cause genes to be swapped by viruses from various species. The virus often changes so much that it may begin to affect and propagate among individuals. Still, at the time of epidemic, the Wuhan market did not sell bats. That's why early suspicion even fell on pangolins, also referred to as kali anteaters, who are illegally smuggled in China in some markets. SARS-CoV-2 is similar to some coronaviruses which infect pangolins. After knowing the history of COVID-19, let's move on to the symptoms of COVID-19. In various forms, COVID-19 influences various persons. Many people infected will experience a mild to severe disease and heal without hospitalization. And here are the most, less, and serious symptoms of COVID-19 according to World Health Organization. Most common symptoms: fever, dry cough, and tiredness. Less common symptoms: aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, and a rash on skin or discoloration of finger or toes. Serious symptoms: difficulty of breathing or shortness of breath, chest pain or pressure, and loss of speech or movement. Moreover, this pandemic is indeed threatening, so let me inform you with the health guidelines of COVID-19 from World Health Organization. Maintain at least 1 meter distance between yourself and others to reduce your risk of infection when they cough, sneeze, or speak. Make wearing a mask a normal part of being around other people. Regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap and water. Avoid touching your eyes, nose, and mouth. Cover your mouth and nose with your bent elbow or tissue when you cough or sneeze. And lastly, clean and disinfect surfaces frequently, especially those who are irregularly touched. Examples are doors, handles, faucet, and phone screens. Furthermore, let's move on to the transmission of COVID-19. According to the World Health Organization, COVID-19 is caused by SARS-CoV-2 virus, which spread between people, mainly when an infected person is in close contact with another person. The virus can spread from one infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe heavily. These liquid particles are different sizes, ranging from larger respiratory droplets to smaller aerosols. Other people can catch COVID-19 when the virus gets into their mouth, nose, or eyes, which is more likely to happen when people are in direct or close contact with the infected person. Current evidence suggests that the main way that the virus spread is by respiratory droplets among people who are in close contact with each other. Aerosol transmission can occur in specific settings, particularly in indoor, crowded, and inadequately ventilated spaces where infected persons spend long periods of time with others, such as restaurants, choir practices, fitness classes, nightclubs, office, and other places of worship. More studies are underway to better understand the condition in which aerosol transmission is occurring outside of medical facilities, where specific medical procedures, called aerosol generating procedures, are conducted. So let's move on the COVID-19 statistics here in the Philippines and worldwide from news.google.com. As we can see, Philippines has 452,000 cases, 419,000 recovered, and 8,812 deaths. And worldwide has 73.5 million cases, 46.6 million recovered, and 1.64 million deaths. After knowing the COVID-19 statistics, let's move forward to COVID-19 treatment, self-care treatment, You can relax, drink plenty of fluids, and eat healthy food if you feel sick. Stay in a different space from other members of the family and use, if possible, a designated toilet. Clean and disinfect surfaces that are touched regularly. A safe lifestyle at home should be practiced for everyone. Maintain a balanced diet, sleep, be active, and make a phone or internet social communication with loved ones. During hard times, children need more affection and care from parents. As far as possible, stick to daily activities and plans. During a crisis, it is common to feel sad, anxious, or confused. It can help to speak to those who you know, such as friends and relatives. Talk to a health nurse or counselor if you're stressed. And lastly, medical treatment. The FDA approved an antiviral medication remdesivir to treat COVID-19 in October 2020. The medication can be used for the care of adults and children 12 years of age and older who have been treated with COVID-19 and who weigh at least 88 pounds. Clinically, trials indicate that the remdesivir can modestly speed up recovery time in these patients. To wrap it all up, COVID-19 is indeed a serious matter not just in the Philippines but also to the whole world. So let us cooperate and stand as one to help each other cure this pandemic caused by COVID-19. Thank you for listening. Keep safe, everyone.